The name smallpox is derived from the Latin word for spotted and refers to the bumps found on the body of an individual suffering from smallpox. Smallpox is known to be caused by the variola virus and can be transmitted from person to person through coughing or sneezing. Similar to a common cold, the beginning symptoms of smallpox are identified as a high fever, fatigue, headaches, and potentially backaches. As many of us know, viruses can only survive at a normal body temperature. The fever experienced by the host is the body's attempt to eradicate itself of the pathogen, increasing the internal body temperature to kill the virus. When the smallpox virus is identified, white blood cells are called to attack the infection. This rapid accumulation of white blood cells leads to the formation of pus and lesions on the skin. In the first few days following contraction, the virus multiplies within the host body. Later, a rash will appear on the legs, arms, and face, and flu-like symptoms will arise. The rash that appears is initially flat, red, and spotty. The rash then evolves into small lesions filled with clear fluid before filling with white, cloudy pus, forming pustules. These pustules then become embedded in the skin and are round and hard. The diagnosis is performed when these pustules develop, and the pus is then tested for the presence of the variola virus. In our society, vaccines are administered in order to develop an immunity to a particular disease. They aim to imitate an infection, administering a small dose of the actual infection minus the harmful and active pathogen. This foreign dosage triggers the immune system to fight. This causes the body to produce both B and T lymphocytes. The pathogen is initially engulfed by a specific kind of white blood cell known as a phagocyte. Inside, the pathogen is digested before being placed on the outer plasma membrane by the MHC protein to await the assistance of a T helper cell. This T helper cell has antigen-specific receptors that bind to the exposed antigen. The binding triggers the phagocyte to activate the T helper cell, which then releases the chemical cytokine before proliferating. This will then produce T cells whose receptors are specific to the antigen presented. The B cell will also undergo antigen presentation, awaiting the help of a T helper cell. A T cell specific to this antigen binds to the protein before releasing cytokines to stimulate the production of specific antibodies by the B cell and its proliferates. Of these antibodies, some will die off, whilst others will remain as what we call memory cells. This process may take several days, but this way, if the individual who has been vaccinated contracts the infection for real, their body will have already produced antibodies specific to the pathogen and can easily recall how to fight it. Public vaccination programs aim to immunize as many people as possible in order to reduce and control the number of people contracting diseases and, in turn, avoid the potential for the world population to be overcome with a pandemic of infection. In Australia, the National Immunisation Program seeks to increase the national immunisation rates by funding free vaccination programs and communicating information about immunisation to the general public and health professionals. This program involves children from as young as a newborn baby to those studying in high school. During the ages of 0 to 4, the child is inoculated with vaccines that combat hepatitis B, tetanus, diphtheria, whooping cough, and many others. Several years later, this program continues onto Australian high school systems, where children are vaccinated for HPV and again for a multiple of diseases. In October of 2015, the Victorian Parliament passed an amendment known as the No Jab, No Play. This rule means that any child who has not been vaccinated against unnecessary diseases will be unable to be enrolled in early childhood education. As cruel as this may sound, it is all in an effort to encourage adults to have their children vaccinated against infectious and potentially deadly diseases. Since the introduction of vaccines, seen in the graphs curated by the Australian Academy of Science, the number of deaths from fatal diseases has dropped dramatically. These statistics prove that vaccines are relatively effective in preventing and controlling levels of diseases within a population. Despite this, some skeptics believe that the MMR vaccine has a connection to the development of autism. The main evidence for this is that early signs of autism develop around the same time that the vaccine has been administered. It is now known that the MMR vaccine is a trigger for a condition known as Dravet syndrome. Despite the re-evaluation of thoughts surrounding MMR and autism, many people still fear the vaccine itself, rather than the disease. Diphtheria is an infection that attacks the respiratory system of the body. A vaccine was produced in the 1920s that prevented people from contracting diphtheria. This vaccination is seen to be most commonly used in national immunisation programs such as that of Australia as well as America. In both countries, children are required to be vaccinated against diphtheria at a series of young ages. The deadly polio virus was at its peak in the 1940s and 50s. In 1955, Dr. Salk made the first anti-polio vaccine. Unfortunately, when produced, the vaccine contained the active virus. The vaccine was amended, but from tragic attempts at vaccination such as this, groups like UNICEF and the World Health Organization have involved themselves with the Global Polio Eradication Initiative. This initiative hopes to completely eradicate the world of polio. Thus far, the program has been effective in vaccinating 2.5 billion children. The Americas, Europe, and Western Pacific have also now been deemed by the initiative as being polio-free. Results such as these prove that this vaccination has and continues to be effective at preventing polio in our world. Smallpox is said to be one of the most devastating diseases known to mankind. Vaccination was birthed by 18th century Edward Jenner, who found that the inoculation of patients with the cowpox virus could protect against smallpox. He deduced from his observation of milkmaids and their exposure to the cowpox virus that they may be immune to the smallpox virus. In 1967, the World Health Organization established a major campaign that sought to eradicate smallpox, developing a new and improved vaccine. Within 12 years, the disease was eradicated. Current health systems do not see much benefit in endorsing vaccination programs, and in America, the smallpox vaccine isn't available to the general public. Nowadays, the only two remaining viruses are contained in America and Russia and are to be strictly used by medical personnel in the case of an outbreak. This is a reasonable act, as we have effectively controlled and prevented any further spread of smallpox in our society.